Hi, I'm Taylor Reimer and I'm going to be inserting a foley catheter. So first I'll review the doctor's order. For Jake nursing, January 1st, 1960. The order says to insert a foley catheter now to monitor fluid balance, intake and output closely. So I'm going to wash my hands, pericare has been done, and I'll gather my supplies. I have my sterile catheter kit, 14 French foley catheter, sterile gloves, and a drainage bag with tubing. So ideally my setup would be the bed here and the bedside table here at waist height, but in this situation this is going to be my bedside table. So I'm going to gather all my supplies and head into the patient's room. I'm doing an entrance safety check. Hi, I'm Taylor Reimer. I'm a student nurse. I'm going to be inserting a foley catheter on you today. Can I just check your wristband, and can you tell me your full name and date of birth, please? Jake nursing, January 1st, 1960. Okay, thank you. So, Jake, today I'm going to be inserting a foley catheter. It's a tube that sits in your bladder and drains the urine into a bag, and we're going to be monitoring your intake and output very closely. Okay, so I'm going to wash my hands and I'm going to attach the drainage bag to a non-movable part of the bag, or of the bed. And then this clip I would attach to the bed sheet, but I don't have a bed sheet in this situation, so I'm going to just secure it here so that it's ready for when I have the catheter in. Alright, I'm going to wash my hands and I'm going to raise the bed to a waist height. I'm going to draw back the sheet and slightly abduct the legs. And now I'm going to open my sterile kit. I would also place an absorbent pad under the patient. I'm inspecting the catheter to make sure it's all still intact. going to attach my syringe of sterile water. Open the povidone swabs. Now I'm going to put the lubricant on 6 to 8 inches of the catheter tip. So I've got the lubricant on. All right. So I'll retract the foreskin to clean. All right, Jake, I'm gonna get you to bear down as if you're going to void, and I'm gonna insert the catheter. So I'm gonna insert it 6 to 8 inches until I see urine. Now I see urine and I'm gonna go 1 to 2 inches more, stabilize, and I'll insert the balloon with 10 cc's of sterile water. Gently tug to make sure it's in place. And I'm going to attach the drainage tubing. And I'm going to secure this to Jake's leg. Okay, so that's secured. At this point, I would do pericare and replace the foreskin. I would note the amount of urine that came out, the color, if there were any sediments. I would clean up my supplies and I did pericare. I would put the bed in the lowest position and the call bell within reach. I would take off my gloves and wash my hands. And then I would go document the procedure. So I inserted a 14 French catheter at this time. I inflated the balloon with 10 cc's of sterile water. I noted the urine that came out, as I previously said, 150 milliliters of clear amber urine. The patient tolerated well. It was inserted on 1 attempt, and we're going to be monitoring closely for intake and output. So I did my exit safety check, and I did that. So now I've received an order from the doctor to remove the Foley catheter. So I would review the order and gather my supplies and go into the patient's room. I'll do an entrance safety check. Hi, I'm Taylor Reimer. I'm a student nurse. I'm going to be taking out your Foley catheter today. So can I check your name band, please? Can you tell me your full name and date of birth? Jake Nursing, January 1st, 1960. Thank you. So Jake, I'm going to be removing your Foley catheter. I'm going to deflate the balloon and then take it out, and you'll be due to void in 8 hours. So I'll be removing that. I'm going to gather my supplies, place an absorbent pad under Jake, and raise the bed. I'm going to wash my hands and put clean gloves on. These are now clean. And I'm going to empty the drainage bag. So from the drainage bag, I would note the amount that I emptied. I would measure it. the color, if there were any sediments or blood clots, and I would note that so I can record it in my IPN later. So that's done. I have clean gloves on, I've done pericare, and now I'll get my sterile 10 cc syringe to take out the water from the balloon. So I'm going to remove the tape from the patient's leg, and I will deflate the balloon. Alright, so the balloon's deflated with 10 cc's of sterile water. So Jake, if you could take a deep breath, I'm going to remove the catheter now. I'm going to inspect the catheter tip to make sure it's intact and wrap it in the absorbent pad and throw this all in the garbage. Okay, at this point I would do pericare. I would clean up all my supplies. I would lower the bed and put the Colwell in within reach. I would remove my gloves and wash my hands, and I'll do my exit safety check, and then I will document the IPN. So I removed a 14 French catheter. I withdrew 10 cc's of sterile water to deflate the balloon. The patient tolerated well. I will document the urine that I emptied from the drainage bag as I previously stated. And yeah, thank you.